So for the next drug on our list, I'll be talking about the pharmacology of what? Spironolactone. Spironolactone. So you get to see that spironolactone is popularly known as what? Aldactone. Right? Popularly known as aldactone. Right? So it's actually what? A potassium sparing diuretics. So when you say something is potassium sparing, what does it mean? Yes, it will actually what? Preserve potassium in the body. Right? It will preserve potassium in the body. Okay. So it's used to treat various conditions like what? Hypertension, heart failure, edema, and the rest. Mechanism of action is an aldosterone antagonist. Right. So it competes with what? Aldosterone for binding to what? Mineralocorticoid receptors in the distal convoluted tubule, also on the collecting duct of the neuron. So therefore, it will actually inhibit the effects of this aldosterone. Then sodium and water excretion. So by blocking the aldosterone, it will promote sodium and water excretion while conserving potassium, contributing to its what? Diuretic and antihypertensive what? Effects. Okay. So it also has what? An anti-andronergic effect. So it also exhibits what? Anti-andronergic effects, activities too, due to its what? Structural similarities with steroidal hormones. Okay. Pharmacokinetics. Absorption. It's well absorbed from the gastrointestinal tract with enhanced bioavailability when you take it with food coming. So distribution is what? Extensively found in what? Plasma proteins, about 90% plasma proteins. Okay. Then coming. Just want to share something to my bro. Excretion is primary in urine and secondary via bile. Onset of action is typically when you take it just 2 to 4 hours after oral administration. Duration of action, its effect will still be felt for like more than 48 to 72 hours. Half-life of spironolactone is about what? 1.4 hours, while its active metabolite, which is what? Canrenone, has a longer half-life of approximately 16 hours. Right? Indications: this is treating hypertension, heart failure, edema, primary what? Hyperaldosteronism. Adverse effect: it can cause electrolyte imbalance, hyperkalemia, too much potassium, hyponatremia, too much sodium, and mild acidosis. It has some endocrine effects, can cause what? Gynecomastia, menstrual irregularities, then gastrointestinal disturbances like what? Nausea, vomiting, diarrhea, and the rest. Okay, so I think this is all. Okay. Contraindication is somebody already has hyperkalemia. You know that the side effect of this drug is hyperkalemia. So you don't want to add problem to problem. Okay. If they have renal impairment, if they have hypersensitivity to spironolactone or any of its components, then drug interaction. It can interact with what? Angiotensin converting enzyme inhibitors. Can can react with what? Non-steroidal anti-inflammatory drugs, also digoxin, okay, and all of that. Okay. So this is for the pharmacology of what? Spironolactone. Alright, so see you guys.